Hello, this is Dr. Do again. This video is continuously from previous talk about systemic approach of medicine from invisible level of major organic compounds to cell and move on to the visible at the tissue level. And I mentioned diseases associated with the epithelial and also associated with the connective tissue, just some examples, and also associated with the muscular tissues and talk of common or rare but could be serious. So today I'm going to move on to another tissue, the last one of the just like connective tissue. The nervous tissue is also quite complicated. Even though the cell itself is kind of very straightforward, cell body and axons, but still the system in the nervous tissue form, the nervous system is, I think, the one of the most complicated system carry on so complexity of functions. So that's why this nerve tissue it's so important. So I left to the last. So when I talk about nerve tissue, you probably right away to your mind is the brain, definitely. And the nerve tissue has two. Actually, the nerve tissue together form the nervous system. There's a central nervous system and also the peripheral. The central refers to the brain and a spinal cord, I already mentioned before. And the peripheral are the nerves, that the nerve fibers or axons to innervate the peripheral, like the around blood vessels, muscles, and skins all over the places. So this is about the general structure, and also in terms of individual nerve cells, the structure is unique, not like the other cells, just wrapped up in a inside of the cell membrane, either a cubic, squamous, or columnar, or other typical. But this nerve cells is usually it had a cell body. It's like just like the cells, but from those cell body there's one end or two ends streaming out the axons, wrapping by the myelin or the sheath structure, and also divided some dendrites like structure to receive or to send signals. So I say it probably is so abstractive, but if you search neuron or nerve cell, you'll find definitely the structure is like a very strange look in terms of the morphology, in terms of the form of nerve cells different from others. But there are some exceptions. There's some cells, nerve cells without long axons, just like the other cells. But on the membrane, branching out dendrites to receive or to send the signals. So this is about fundamental the nerve cells and also the nerve tissues, and the organization, how the nerve system organized. In terms of the diseases associated with this nervous tissue, it's so obvious. It's so from very common stroke, you already heard of it, just either ischemic or hemorrhage, or either common, not just only common and also serious, it could be life-threatening, or from the minor neuritis, just for example, the optic neuritis or the Bell palsy example, just after the upper respiratory tract infection, the virus there causes this Bell's palsy, which means the drooping lid, and also drooling, and just one side of the face from the facial nerve, which is the peripheral nerve, causes this transient neuropathy usually. If it is post-viral infection. So this is quite common, and usually it's self-limited, like neuritis, optic neuritis, just after the upper respiratory infection, develop this eye pain, deep back of the eye pain. And even though, but if you have that, I still encourage you, whether you have the drooping or drooling on one side of the face, lost the sensation, but you still, even though may self-limit, will recover by itself, but still you need to see the physician to diagnose, to exclude the serious condition. There's some stroke, very similar, mimic the Bell's palsy actually, the same symptoms, just spare the forehead, but you do not know it. Just so if you have those kind of symptoms, or if you feel the eye pain, the pain on the eyes and the back, inside the eyes, you need to see your physician. Even though probably you do not feel any impaired vision, but still you need to see your doctors to identify, to diagnose, to exclude serious problems. So this is talk about in terms of stroke. Of course, it's I think it's because of the alert of the stroke and the emergency system. So you probably know if you have risk factors, either hypercoagulation or hypertension, hyperlipidemia, coronary artery disease, or AFib, etc. So if you have those kind of conditions, your physician probably already alert you the signs of stroke. So if you have those symptoms or signs, definitely do not hesitate to call the either stroke alert line or call the emergency as soon as possible. And in terms of other diseases, infections, bacterial infections, meningitis or encephalitis, those are encephalitis can be caused by viral. Actually, majority of case, encephalitis could be just part of the viral infection, either from the mosquito carried or any other conditions and spread. Those encephalitis quite usually, I think it's quite serious compared to meningitis. The meningitis is could be caused by bacteria, even though when we talk about the bacterial infection, always serious than the viral infection. But this case, encephalitis even though caused by the virus infection, still could be very serious. Could leading to loss of neurological function, focal deficit, or sometimes if the swelling is too severe, cause the increase intracranial pressure, cause the hernia of the intracranial structures that could be life-threatening. So the signs, severe headache, altered mental status, and also for the meningitis, of course, I already mentioned that feel natural rigidity, feel the neck stiff, and feel very tight, and projectile vomiting, and may or may not have a neurological deficit, but the encephalitis probably have the neurological deficit. Depends on the severity. So this is about the infection, and also peripheral, either in addition to neuritis and peripheral neuropathy. It's also quite common. It could be part of systemic diseases such as the either diabetes, the very common diabetic peripheral neuropathy, feel tingling, numbness, and also associated with controlled blood sugar. So those I think those patients, particularly long-term diabetic patient, and also blood sugar is not very well controlled, HbA1c is not well controlled. I'm sure you need to follow up with your neurologist to make sure. And also some other neuropathies associated with the, for example, lupus. Lupus might have this neuropathy, subtle or obvious, but still. So sometimes neuropathy is usually it could be isolated neuropathy or could be part of the systemic disease. And also the other neurological conditions, tumor, for example, or the seizures, or some other conditions. So this is about the, but I think on top of that, extracted the most serious stroke. So if that's the case, I think if you follow my previous video, you already see it. So I'm going to stop here today, and thank you for watching. I will see you next time.